Chances are you or someone you know are currently dealing with some sort of mental health concern. The month of May kicks off the start of the Kern Behavioral Health and Recovery Services Grounded in Health initiative. It's a time where they host an array of events to shine light on the importance of mental health. 23 ABC's Breanna Polk spoke with county officials today and brings us more details about their mission of supporting and uplifting those who may be struggling with reaching out for help.
As the month of May is Mental Health Awareness Month, the Kern Behavioral Health and Recovery Services is highlighting this year as Seeking Help Month. The idea behind this initiative is to encourage people to never be ashamed or afraid to ask for help when it comes to one's mental health.
Seeking help is actually a signal of strength. You're actually being very strong by seeking help, by reaching out and admitting that you can't do things on your own.
Breanna Kerrigan, Director of Kern County Public Health, says addressing mental health issues is key in one's life because it also plays a role in physical health as well. These thoughts are also shared by Stacy Kuwahara, Director of Kern Behavioral Health and Recovery Services, who says seeking help and connecting with one another is one of the most meaningful ways that we can care for ourselves and our loved ones.
It's so important to be talking about mental health and to bring awareness events forward to really support ending stigma and making kind of our ideas about mental health, normalizing them, introducing people to where they can go to get help, and giving them just small reminders that we're here and all of the great resources in our community.
Kuwahara says in the U.S., just under 20% of people, or 1 in 5, are living with mental health conditions, and less than half are seeking help when they need it. She says negative societal perceptions discourage people from talking about their mental health needs, also create barriers, and that is why the department is working to change that stigma. Some of the resources they offer include substance abuse, crisis intervention, and family counseling, among others.
You don't have to be alone, you don't have to suffer, and there is help out there. I encourage everybody to seek help in any way that they are comfortable. There are a number of resources that are available now that make it very easy for people to reach out, and we have a lot of wonderful things here in Kern and a lot of amazing, caring people that are there for you.
To keep the conversation of mental health going, Kerrigan says they each will be wearing lime green throughout the month of May, which helps raise awareness.
All wearing green every Friday to really join in unity to show our community that addressing mental health should not be something that's feared, it should not be stigmatized, and together we're going to overcome that.
And a list of upcoming mental health awareness events and resources can be found on our website, turnto23.com. In Bakersfield, I'm Breanna Polk, 23 ABC News, connecting you.
And staying on topic with mental health, we took an in-depth look at the numbers reflecting the severity of the issue nationwide. According to the National Alliance on Mental Health, 1 in 5 U.S. adults experience mental illness each year. Additionally, 1 in 25 adults experience a serious mental illness on an annual basis. National data shows 50% of all lifetime mental illness begins by age 14 and 75% by age 24. Lastly, the average delay between the onset of mental illness symptoms and treatment is 11 years.